Hi, this is Dr. Kevin Kirby coming to you from Northern California. Today I want to demonstrate for you a new clinical technique for finding the subtalar joint axis spatial location in a weight-bearing position. So what we're going to do is show you how this technique is performed and how simple it is to estimate the subtalar joint axis location in the weight-bearing or standing position. The first step in the standing subtalar joint axis location test is to find the enter exit point of the subtalar joint axis from the dorsal middle neck of the talus. So to find the talar head, medial lateral border, we're going to put our fingers, one finger medial here, one finger lateral, palpate for the talar head. We can have the foot supinate slightly and pronate slightly, and then stand normally. So what I'll do from there is then mark the approximate anterior exit point of the subtalar joint, which is going to be through the middle of the dorsal neck of the talus. So let's go ahead and put a mark here, overlying the middle aspect of the dorsal neck of the talus. So the next step in this standing subtalar joint axis location test is to approximate the posterior exit point of the subtalar joint from the posterior aspect of the calcaneus. This is going to be approximately in the quadrant of the calcaneus, which is on the superior lateral aspect. And I'm going to draw this quadrant here. So the superior lateral quadrant. So here's our quadrant, heel bisection, and here's a transverse line. This quadrant is the approximate location that the subtalar joint axis will pierce out the posterior aspect of the foot. And let's go ahead and put an X on that location also. So now we have the posterior exit point of the subtalar joint axis coming out through the posterior lateral superior quadrant of the calcaneus. And also we have the anterior exit point, which we've already marked. So now with the anterior exit point of the subtalar joint axis marked, overlying the midsection of the dorsal neck of the talus, and its posterior aspect marked on the posterior lateral superior quadrant of the calcaneus, we can now use a simple pen or pencil to mark the spatial location of the subtalar joint axis. So here now I'm going to use a pen and put the pen directly on the anterior exit point of the subtalar joint axis, and I'm going to have the pen point directly toward the posterior exit point on the posterior lateral superior calcaneus. So here I've got the position in the sagittal plane, and then I'm going to look at it from this side to make sure that the angle is right. I'm pointing at the right location. And we can look from all the directions. And here we have the subtalar axis location. So here's the anterior mark on the midsection of the dorsal neck of the talus. Go ahead and pronate and supinate your foot slightly. We see how the mark's moving along with the dorsal neck of the talus. And just relax. And then we go ahead and look at the foot from the lateral aspect and posterior aspect. We see the posterior exit mark. And so when we now look at that axis location, we can see the two marks, both anteriorly and posteriorly. And this is going to give a good approximation of the subtalar joint axis. So now we have the ability to find the subtalar joint axis three-dimensional location in the standing position. First we'll take our pen, point it toward the anterior exit point of the subtalar joint axis, which is in the middle section of the dorsal neck of the talus, and we'll then point that toward the posterior lateral superior quadrant of the calcaneus, where the most likely location for the posterior exit point of the subtalar joint axis is. Then I'll align that pen directly to pierce through to that posterior lateral superior quadrant of the calcaneus. And here we have it. So then now we see the subtalar joint axis is inclinated approximately 40 degrees. from the transverse plane. And we also see that it's approximately 15 degrees medially deviated from the mid-sagittal plane, which gives us our approximate subtotal axis spatial location so that we can determine the subtotal axis location in the standing position. So this is yet another technique we can use to evaluate the subtotal axis. It takes very little time and can give you a better approximation of the subtotal axis location in 3 dimensions in your patients in the weight-bearing position. Thank you very much, and I hope you enjoyed the video.